Why do so many adults over 50 struggle daily with joint pain, stiffness, high blood pressure, blood sugar problems, and memory decline, while some people in Japan live past 90 or even 100 with low levels of chronic inflammation and remain physically and mentally functional? Have you ever noticed how inflammation seems almost unavoidable with aging in Western countries, yet appears far less common among Japanese centenarians? What you're about to discover may surprise you, because this difference is not explained by genetics, luck, or access to advanced medical treatments. It is also not the result of extreme diets, supplements, or short-term health trends. Instead, it reflects something far more consistent and measurable: long-term daily food choices that quietly influence inflammation over decades. Chronic inflammation is one of the most important, and most underestimated, drivers of aging-related disease. Unlike acute inflammation, which helps the body heal after injury or infection, chronic low-grade inflammation operates silently. It slowly damages joints, stiffens blood vessels, disrupts insulin signaling, and accelerates cognitive decline. By the time symptoms appear, the process has often been active for years. In adults over 50, this inflammatory background becomes a central factor behind arthritis, cardiovascular disease, type 2 diabetes, and neurodegenerative conditions. After midlife, the body becomes more vulnerable to this process for several biological reasons. Metabolism gradually slows, making it easier for excess energy to convert into inflammatory signals. Muscle mass decreases, reducing glucose disposal and increasing insulin resistance. The immune system also changes, becoming more reactive but less precise, which promotes persistent inflammation rather than resolution. Together, these shifts explain why aging after 50 often feels like a steady accumulation of physical limitations rather than a single sudden decline. Yet when researchers examine Japanese centenarians, they consistently observe something different. Blood tests often show lower levels of inflammatory markers compared to Western adults decades younger. Rates of severe joint degeneration, metabolic disease, and cardiovascular complications are markedly lower. This pattern appears across regions and socioeconomic levels in Japan, suggesting a shared lifestyle factor rather than isolated individual behavior. Importantly, this is not a miracle and not a genetic anomaly. When Japanese people migrate and adopt Western eating habits, their inflammation profiles and disease risks gradually begin to resemble those of the surrounding population. This tells us that the protective effect is largely environmental, and diet plays a central role. The traditional Japanese diet emphasizes specific foods eaten in modest portions, consistently, day after day, for a lifetime. These foods directly influence inflammatory pathways, gut health, vascular function, and immune regulation. I am a Japanese physician in my later years, with decades of experience in preventive medicine and longevity-focused care. From a clinical perspective, the most striking difference is not what Japanese centenarians avoid, but what they repeatedly include. Their approach to healthy aging is built on prevention rather than correction. Instead of waiting for inflammation to cause symptoms and then treating it aggressively, the goal is to keep inflammatory pressure low throughout life. This is achieved through simple, familiar foods that are part of everyday meals, not through supplements or restrictive programs. In medical practice, this consistency matters more than intensity. Small daily reductions in inflammation, repeated over decades, accumulate into meaningful protection of joints, blood vessels, metabolic systems, and brain function. This is why Japanese longevity cannot be reduced to a single superfood or secret ingredient. It is the result of a narrow set of anti-inflammatory foods eaten regularly, in forms that the body recognizes and uses efficiently, especially after age 50. In the next part, we will begin examining the first of 3 specific anti-inflammatory foods that appear consistently in the diets of Japanese centenarians, and why its biological effects remain especially relevant as the body ages. To understand why these foods matter, it helps to look at how inflammation is influenced on a daily basis. In clinical observation, inflammation is not driven by a single meal or an occasional indulgence. It rises or falls based on what the body is exposed to repeatedly. When certain foods are eaten every day, they shape gut bacteria, hormone responses, blood lipid profiles, and immune signaling in predictable ways. Over time, this daily input determines whether inflammation remains controlled or slowly escalates. In Japanese longevity studies, one pattern appears consistently: centenarians consume foods that actively calm inflammatory pathways rather than overstimulate them. These foods tend to be minimally processed, prepared simply, and eaten in modest portions. From a biological standpoint, this matters because aging cells respond poorly to excess glucose spikes, unstable fats, and inflammatory additives. After 50, the margin for dietary stress narrows, and the body becomes less efficient at correcting repeated insults. Another key factor is digestion. As people age, stomach acid production, enzyme output, and gut barrier function often decline. This can allow partially digested food particles to trigger immune responses, increasing systemic inflammation. Traditional Japanese foods are generally easier to digest and often support beneficial gut bacteria. This reduces immune activation at the intestinal level, which is where a large portion of chronic inflammation begins. Rather than relying on supplements or isolated nutrients, Japanese elders typically obtain anti-inflammatory compounds directly from food. This includes naturally occurring fats, fermentation byproducts, minerals, and plant-based antioxidants that work together. The body recognizes these compounds as familiar inputs, which allows them to be absorbed and used efficiently. In contrast, large doses of isolated substances may not produce the same steady effect, especially in older adults. It is also important to note frequency. These foods are not consumed occasionally or only when health concerns arise. They are part of breakfast, lunch, or dinner routines, often appearing several times per week or even daily. This repetition creates a stable internal environment. In medical terms, consistency reduces inflammatory variability, which is often more damaging than short-term elevations. Once this pattern is understood, the difference in inflammatory aging becomes easier to explain. Lower inflammation is not the result of strict control, but of alignment between food choice and aging physiology. Have you noticed how certain foods leave you feeling lighter and more comfortable, while others seem to cause stiffness or fatigue later in the day? With this foundation in place, we can now look closely at the first specific food commonly eaten by Japanese centenarians, how it directly affects inflammatory markers, and why it remains especially beneficial after age 50. Chronic low-grade inflammation is a persistent, subtle activation of the immune system that remains present even when there is no injury or infection. Unlike acute inflammation, which appears suddenly with pain, swelling, or fever and then resolves as healing occurs, chronic inflammation operates quietly in the background. There may be no obvious warning signs at first. Blood vessels, joints, nerves, and internal organs are exposed to inflammatory signals day after day, often for years, before measurable disease develops. This constant exposure slowly alters how tissues function and repair themselves. Biologically, this ongoing inflammatory signaling affects the body in several interconnected ways. In blood vessels, it promotes stiffness and microscopic damage to the inner lining, increasing the risk of hypertension and cardiovascular disease. In joints, it accelerates cartilage breakdown and reduces lubrication, contributing to stiffness and chronic pain. In metabolic tissues, it interferes with insulin signaling, making it harder for cells to absorb glucose efficiently. In the brain and nervous system, it disrupts communication between neurons and increases vulnerability to cognitive decline. None of these effects happen overnight, but their long-term impact is cumulative and predictable. After age 50, controlling this process becomes more difficult due to normal biological changes associated with aging. Cells become less efficient at repairing inflammatory damage. The liver and kidneys, which play key roles in detoxification and waste removal, work more slowly. Muscle mass decreases, reducing the body's capacity to buffer blood sugar spikes. At the same time, the immune system tends to remain partially activated even without a clear threat, a phenomenon commonly observed in older adults. Together, these changes mean that the same dietary and lifestyle choices that were once tolerated can now produce a stronger inflammatory response. Now I want to go deeper into this by addressing a common misconception. Many people believe inflammation is only a problem when symptoms are severe or when laboratory values are clearly abnormal. As a result, they focus on treating inflammation only after pain, disease, or diagnosis appears. The consequence of this approach after 50 is that inflammation is addressed too late, once structural damage has already accumulated. Medications may relieve symptoms, but they do not reverse years of inflammatory exposure at the cellular level. In contrast, Japanese elders approach inflammation as something to be managed continuously rather than corrected episodically. In clinical observation, their daily decisions are oriented toward keeping inflammatory input low from the start. This is not achieved through restriction or complex planning, but through consistent food choices that place minimal stress on metabolic and immune systems. Meals are structured to avoid sharp glucose fluctuations, excessive saturated fats, and highly processed ingredients that stimulate inflammatory pathways. The emphasis is not on eliminating inflammation completely, which is neither possible nor desirable, but on preventing it from becoming chronic. Diet plays a central role here because it is the most reliable daily lever influencing inflammation. Every meal delivers signals to the immune system through digestion, nutrient absorption, and gut bacteria activity. Over time, these signals either reinforce inflammatory patterns or help regulate them. Japanese elders typically consume foods that are familiar to the body, easy to digest, and naturally balanced in fats, minerals, and bioactive compounds. This consistency reduces the need for the body to mount repeated immune responses after eating. Applied realistically, this means focusing less on dramatic dietary changes and more on stable patterns. Choosing meals that support steady blood sugar, avoiding excessive processing, and repeating the same supportive foods week after week has a measurable long-term effect. Prevention in this context is not a special intervention but a series of small, repeated decisions that gradually lower inflammatory load. Comment: this makes sense to me. With this understanding of why chronic inflammation becomes the main biological challenge after 50, the explanation can move forward by examining how specific everyday food choices directly influence this process. Fermented soy foods such as natto and miso are traditional staples in the daily diets of many Japanese elders. These foods are made from soybeans that undergo a controlled fermentation process, transforming them from a simple plant protein into a biologically active food. Natto is most commonly eaten with rice, especially in the morning, while miso is used as the base of soups consumed regularly throughout the day. These are not specialty health foods in Japan, but ordinary items found in most households, eaten in small amounts with consistency. The reason fermented soy has such a measurable impact on inflammation lies in what happens during fermentation. The process breaks down complex proteins and carbohydrates, creating bioactive compounds that are easier for the body to absorb. These compounds include peptides, enzymes, and beneficial bacteria that directly influence immune signaling. In simple terms, fermented soy helps reduce the production of inflammatory cytokines, which are chemical messengers that keep the immune system in a constantly activated state. At the same time, it supports healthier communication between the gut and the immune system, where much of chronic inflammation originates. Now I want to go deeper into this by explaining why this matters even more after age 50. As people age, gut diversity tends to decline. The lining of the intestine becomes more permeable, and the immune system reacts more strongly to food particles and bacteria that would have been tolerated earlier in life. This increases low-grade inflammation throughout the body. Fermented soy addresses this problem on two levels. First, it delivers beneficial bacteria and fermentation byproducts that support gut balance. Second, it reduces digestive stress by presenting nutrients in a predigested form, requiring less effort from an aging digestive system. A common misconception is that soy itself is the main benefit, regardless of how it is prepared. Many people assume that eating any soy product, especially highly processed ones, will produce the same effect. The consequence of this mistake after 50 is that the body may be exposed to soy proteins without the protective effects of fermentation. In some cases, this can increase digestive discomfort or immune activation rather than reduce it. Unfermented or heavily processed soy products lack the bioactive compounds that modulate inflammation and may even contribute to imbalance when consumed in large amounts. Japanese elders approach this differently by prioritizing fermentation over quantity. They do not consume large portions of soy, nor do they rely on soy-based substitutes. Instead, they include small servings of fermented soy as part of regular meals. Natto may appear several times per week in modest amounts. Miso soup is often consumed daily, but the portion is small and the preparation gentle, preserving its active components. This approach emphasizes regular exposure rather than intensity, which aligns well with the needs of aging physiology. Applied realistically, this does not require a major dietary overhaul. Fermented soy can be introduced gradually and in familiar formats. A small bowl of miso soup alongside a meal, or a spoonful of natto mixed with rice, is sufficient. The goal is not to replace other foods, but to add a consistent element that supports gut and immune balance. Over time, these small daily choices create a cumulative anti-inflammatory effect without placing stress on digestion or metabolism. The long-term effect of this practice is not dramatic or immediate, but steady. By reducing immune overreaction at the gut level, fermented soy helps lower the baseline inflammatory load that accumulates with age. This supports joint comfort, vascular health, and metabolic stability in a way that is subtle but biologically meaningful. Consistency matters more than variety here, and simplicity matters more than optimization. Comment: I'm starting with one change. With this foundation established, the discussion can continue by examining how other everyday foods interact with inflammation through different biological pathways, further shaping long-term outcomes. Oily fish such as mackerel, sardines, and salmon are regular components of meals consumed by many Japanese elders, particularly those who live into their 90s and beyond. These fish are not treated as special health foods, but as ordinary protein sources prepared simply and eaten repeatedly over time. In coastal and inland regions alike, fish appears grilled, lightly simmered, or served with rice and vegetables. The defining feature is not variety or volume, but consistency in choosing fish rich in natural fats. The primary biological value of these fish comes from their omega-3 fatty acids, especially EPA and DHA. These fats play a direct role in regulating inflammation. Inside the body, omega-3s compete with inflammatory fats for the same metabolic pathways, leading to the production of compounds that actively calm immune signaling. In practical terms, this means fewer inflammatory messages circulating through blood vessels, joints, and connective tissue. Omega-3s also help maintain flexibility in cell membranes, which improves blood flow and supports joint lubrication, reducing mechanical stress over time. Now I want to go deeper into this by explaining why omega-3 intake becomes more critical after age 50. As people age, the balance between inflammatory and anti-inflammatory fats often shifts in the wrong direction. Diets higher in processed foods and refined oils tend to increase omega-6 intake, which promotes inflammation when not balanced properly. At the same time, the body's ability to convert fats efficiently declines. This combination increases the risk of stiffness, vascular damage, and metabolic inflammation. Low omega-3 levels are commonly associated with joint discomfort, elevated cardiovascular risk, and reduced insulin sensitivity in older adults. A common misconception is that omega-3s can be addressed occasionally or replaced entirely by supplements. Many people assume that eating fish once in a while or taking capsules intermittently provides the same benefit. The consequence of this approach after 50 is that inflammatory pathways remain active most of the time, with only brief periods of suppression. Supplements may help in specific cases, but they do not replicate the broader nutritional context of whole fish, which includes protein, minerals, and naturally balanced fats that work together during digestion and absorption. Japanese elders approach this differently by integrating oily fish into regular meals rather than treating it as an intervention. Fish is eaten several times per week, often in modest portions that the body can process easily. Preparation methods are simple, avoiding heavy breading, deep frying, or high-temperature cooking that can damage fats and create inflammatory byproducts. Grilling, steaming, or lightly simmering preserves the structure of omega-3s and keeps the meal digestible, which is especially important for aging digestive systems. Portion size also plays a role. Instead of large servings, Japanese meals typically include a small fillet or a few pieces of fish alongside rice and vegetables. This supports steady nutrient intake without overwhelming metabolism or digestion. The goal is not to maximize omega-3 intake in a single meal, but to maintain a reliable supply over time. This pattern supports long-term vascular health, joint comfort, and metabolic stability through repeated exposure rather than intensity. Applied realistically, this can be adapted without major disruption. Choosing oily fish 2 to 4 times per week, preparing it simply, and keeping portions moderate is sufficient. Canned sardines or mackerel prepared without heavy sauces can also serve this role when fresh fish is less accessible. The emphasis is on regular inclusion rather than perfection, allowing daily choices to accumulate into a meaningful long-term effect on inflammation. Comment: This makes sense to me. With this approach established, attention can continue moving forward by examining how additional everyday foods influence inflammation through complementary biological mechanisms, reinforcing the same preventive pattern. Sea vegetables such as wakame, kombu, and nori are a daily but often overlooked part of traditional Japanese meals. These foods are harvested from the ocean, dried, and used in small amounts as ingredients rather than main dishes. Wakame is commonly added to soups, kombu is used to prepare broths, and nori is wrapped around rice or cut into thin strips as a garnish. For many Japanese elders, these sea vegetables appear so regularly that they are barely noticed, yet their biological impact accumulates over decades. The medical value of sea vegetables lies in their unique concentration of minerals, antioxidants, and bioactive compounds that are difficult to obtain from land-based foods. They help reduce oxidative stress, which is a major driver of chronic inflammation. Oxidative stress occurs when unstable molecules damage cells and trigger immune responses. Sea vegetables contain compounds that neutralize these molecules and help regulate immune activity, lowering the constant inflammatory signaling that damages tissues over time. They also support fluid balance and cellular communication, both of which are essential for maintaining stable immune responses. Now I want to go deeper into this by explaining why these effects become more important after age 50. As people age, the ability to absorb minerals such as iodine, magnesium, and calcium often declines. At the same time, the thyroid gland, which plays a central role in metabolism and immune regulation, becomes more sensitive to imbalance. Sea vegetables provide naturally balanced minerals that support thyroid function without excessive stimulation. This balance helps stabilize energy use and immune signaling, reducing the risk of inflammation driven by hormonal fluctuation. A common misconception is that sea vegetables are either unnecessary or potentially harmful due to their mineral content, particularly iodine. Some people assume that these foods should be avoided entirely or consumed only in very small, infrequent amounts. The consequence of this misunderstanding after 50 is that beneficial compounds are removed from the diet altogether, while the body continues to struggle with mineral imbalance and oxidative stress. Avoidance eliminates the regulatory effect that small, regular intake provides and may increase reliance on supplements that do not behave the same way in the body. Japanese elders approach sea vegetables with moderation rather than avoidance. They do not consume large quantities, nor do they treat them as concentrated health products. Instead, they use small amounts consistently, allowing the body to adapt and regulate intake naturally. Kombu is simmered gently to make broth, releasing minerals into soups without overwhelming the system. Wakame is rehydrated and added in thin portions. Nori is used as a wrapper or topping, contributing flavor and nutrients without dominating the meal. This steady exposure supports mineral balance and immune regulation over time. Applied realistically, this approach is simple to replicate. Sea vegetables do not need to replace familiar foods. A small piece of kombu added to a pot of soup, a handful of wakame mixed into broth, or a sheet of nori eaten with rice is sufficient. The focus is not on quantity, but on regular inclusion. These foods integrate easily into meals without changing overall structure or flavor preferences, making consistency more achievable. The long-term effect of these daily choices is subtle but meaningful. By supporting antioxidant defenses and mineral balance, sea vegetables help lower inflammatory pressure that increases with age. Their impact comes from repetition and simplicity, not from intensity or novelty. Comment: this makes sense to me. With these elements in place, the explanation can continue to build on how consistent dietary patterns work together to influence inflammation and aging in a predictable way. The behavior being discussed here is not a single food choice, but the consistent combination of fermented soy, oily fish, and sea vegetables within ordinary meals. These foods are not consumed in isolation in traditional Japanese eating patterns. They appear together across the day in simple preparations, creating a dietary structure where each element supports the function of the others. The result is a combined effect on inflammation that is stronger and more stable than any one food acting alone. Biologically, this works because different systems involved in inflammation are interconnected. Fermented foods primarily influence gut health and immune signaling. Omega-3 fatty acids from fish act directly on inflammatory pathways and blood vessel function. Sea vegetables contribute minerals and antioxidants that regulate oxidative stress and hormonal balance. When these foods are eaten together, they reinforce one another. A healthier gut improves nutrient absorption, including fat-soluble compounds from fish. Stable fat intake helps transport and utilize antioxidants and minerals. Reduced oxidative stress lowers immune overactivation, which in turn protects gut integrity. This creates a reinforcing loop that steadily lowers inflammatory pressure. Now I want to go deeper into this by explaining why this combined approach becomes especially important after age 50. Aging bodies are less adaptable to isolated inputs. Digestion slows, absorption becomes less efficient, and regulatory systems respond poorly to sudden or excessive stimulation. When nutrients are delivered together in food, rather than separately as isolated supplements, they are processed more gradually and predictably. This reduces metabolic stress and allows anti-inflammatory mechanisms to remain active throughout the day instead of peaking briefly and then fading. A common misconception is that targeting inflammation requires focusing on one powerful nutrient at a time. Many people attempt to address aging-related inflammation by rotating supplements or emphasizing a single, key food. The consequence of this strategy after 50 is inconsistency. Inflammatory pathways are suppressed temporarily, but other contributing factors remain unaddressed. For example, omega-3 intake may increase without improvements in gut health, limiting its effectiveness. Antioxidants may be consumed without adequate fat for absorption. Over time, this fragmented approach produces limited long-term effect. Japanese elders approach this differently by relying on meals that naturally combine complementary foods. A bowl of miso soup prepared with kombu broth, served alongside grilled fish and rice, is a common example. Fermented soy supports digestion and immune balance. The fish provides anti-inflammatory fats that protect vessels and joints. The sea vegetables contribute minerals that stabilize metabolic and hormonal function. None of these foods is emphasized as a treatment. They are simply part of the meal, eaten without calculation or restriction. This pattern removes the need for conscious dieting. Decisions are simplified because the structure of the meal already supports inflammation control. Portions remain modest, preparation methods are gentle, and repetition is normal. Over time, this consistency produces a long-term effect that is difficult to replicate with isolated interventions. The body receives balanced input repeatedly, allowing regulatory systems to remain stable rather than reactive. Applied realistically, this does not require recreating traditional Japanese cuisine in full. The principle is combination rather than substitution. A simple soup with fermented seasoning, a serving of oily fish, and a small amount of sea vegetables added to a familiar meal is enough. The emphasis is on assembling foods that work together, not on precision or variety. Daily choices become easier because they follow a pattern instead of rules. Comment: this makes sense to me. With this combined framework established, the explanation can continue moving forward by examining how everyday eating patterns influence inflammation through timing, portions, and preparation in equally practical ways. The habit being examined here is portion size and frequency, specifically the way Japanese centenarians consume anti-inflammatory foods in small, regular amounts rather than in large or irregular servings. This pattern applies across meals and across the day. Fish, fermented foods, and sea vegetables are present often, but never in excess. The focus is not on fullness or restriction, but on maintaining a steady intake that the body can process without strain. Biologically, this approach has a clear impact on inflammation. Smaller portions place less stress on digestion and reduce large fluctuations in blood sugar. When meals are moderate, glucose enters the bloodstream gradually, and insulin is released in controlled amounts. This stability limits the activation of inflammatory pathways that are triggered by repeated spikes in blood sugar and insulin. Digestive organs also work more efficiently under these conditions, producing fewer inflammatory signals related to gut irritation or overload. Over time, this reduces the background level of inflammation that quietly damages tissues. Now I want to go deeper into this by explaining why portion size becomes a critical factor after age 50. As the body ages, insulin sensitivity declines, meaning cells respond less effectively to insulin's signal. Large meals, especially those high in refined carbohydrates or fats, produce higher and longer-lasting blood sugar elevations. This forces the pancreas to release more insulin, increasing inflammatory signaling throughout the body. At the same time, digestion slows, and larger meals remain in the stomach and intestines longer, increasing mechanical and immune stress. These effects combine to make overeating a significant driver of inflammation in older adults. A common misconception is that eating healthy foods allows for larger portions without consequence. Many people assume that as long as food quality is good, quantity does not matter. The consequence of this belief after 50 is that even nutrient-rich foods can contribute to inflammation when consumed in excess. Large portions overwhelm metabolic and digestive capacity, leading to glucose instability and increased immune activation. Over time, this undermines the long-term effect of otherwise beneficial food choices. Japanese elders approach this differently by prioritizing frequency over quantity. Instead of eating large meals infrequently, they eat smaller meals or portions consistently. A modest bowl of rice, a small piece of fish, and a light soup may appear at multiple meals rather than being concentrated into one large serving. This keeps energy intake steady and allows the body to maintain balance throughout the day. The goal is not to eat less overall, but to distribute intake in a way that minimizes metabolic stress. This pattern also supports appetite regulation. When meals are moderate, hunger and fullness signals remain reliable. This reduces the likelihood of overeating later in the day, which often leads to inflammation through blood sugar spikes and digestive overload. Over decades, this steady rhythm produces a long-term effect on inflammation that is difficult to achieve through sporadic dietary control. Applied realistically, this means adjusting expectations around portion size rather than changing food identity. Using smaller bowls, serving moderate amounts, and eating these foods several times per week instead of occasionally in large quantities is sufficient. The emphasis is on repetition and consistency. Daily choices become simpler because they follow a predictable pattern rather than relying on willpower or strict rules. Comment: this makes sense to me. With this understanding in place, the explanation can continue to build by examining how everyday eating habits influence inflammation through preparation methods and pacing, reinforcing the same preventive structure. The behavior being examined here is the use of gentle cooking methods that preserve the anti-inflammatory properties of food. In many Japanese households, foods are prepared in ways that apply lower temperatures, shorter cooking times, and minimal processing. Grilling over moderate heat, steaming, simmering, and light sautéing are common practices. These methods are not chosen for health trends, but because they maintain flavor, texture, and digestibility while placing less stress on the food itself and, ultimately, on the body. From a biological perspective, cooking method directly affects how food interacts with inflammatory pathways. High heat and aggressive processing alter fats, proteins, and carbohydrates in ways that create compounds the body recognizes as irritants. When oils are overheated or foods are charred, oxidative byproducts form. These substances increase oxidative stress and trigger immune responses designed to neutralize damage. While younger bodies can often manage this exposure efficiently, repeated intake contributes to chronic inflammation over time. Now I want to go deeper into this by explaining why this becomes more significant after age 50. As people age, detoxification pathways in the liver and kidneys become less efficient. The body clears oxidative byproducts more slowly, allowing them to circulate longer and interact with tissues. At the same time, antioxidant defenses decline, reducing the ability to counteract this stress internally. This means that foods prepared at very high temperatures or heavily processed place a greater inflammatory burden on older adults, even when the foods themselves are otherwise nutritious. A common misconception is that cooking method matters far less than food choice. Many people believe that if they are eating the right ingredients, preparation style is secondary. The consequence of this belief after 50 is that anti-inflammatory foods can lose much of their benefit. For example, fish cooked at excessive heat can produce damaged fats that promote inflammation rather than reduce it. Fermented foods exposed to prolonged heat can lose beneficial bacteria and enzymes. Over time, these losses reduce the long-term effect of otherwise supportive dietary decisions. Japanese elders approach cooking differently by prioritizing preservation over intensity. Fish is often grilled gently or simmered rather than fried. Vegetables and sea vegetables are added toward the end of cooking to maintain structure and nutrients. Soups are kept at moderate temperatures, and reheating is done carefully. These practices reduce the formation of inflammatory compounds while keeping meals simple and familiar. The goal is not to avoid cooking, but to apply enough heat to make food safe and enjoyable without degrading its biological value. This approach also improves digestibility. Gently cooked foods are easier to break down and absorb, reducing immune activation in the gut. When digestion proceeds smoothly, fewer inflammatory signals are released, supporting the same low inflammatory environment reinforced by portion size and food combination. Over decades, this consistency has a measurable impact on tissue health, vascular function, and metabolic stability. Applied realistically, this does not require specialized equipment or advanced techniques. Simple adjustments are sufficient. Cooking at lower heat, avoiding deep frying, limiting charring, and using water-based methods like steaming or simmering protect nutrients without changing food choices. Oils can be added after cooking rather than overheated. Foods can be cooked until just done rather than browned aggressively. These small decisions accumulate into a meaningful long-term effect on inflammation. Consistency matters more than precision. Gentle cooking applied most of the time produces better results than occasional strict control. This aligns with the broader pattern seen among Japanese elders, where daily choices quietly reinforce prevention without conscious effort or restriction. Comment: this makes sense to me. With this layer added, the explanation can continue moving forward by examining how these food choices and preparation habits work together within everyday routines to support stable, low-inflammatory aging. If you followed this explanation from start to finish, you now have a clear, practical picture of how Japanese centenarians approach food, inflammation, and aging in a way that is simple, repeatable, and grounded in biology. Nothing here depends on extremes, special products, or short-term changes. It's about understanding how everyday decisions accumulate and how small adjustments, applied consistently, shape long-term health after 50. If this type of calm, evidence-based explanation is useful to you, subscribing makes sense as a practical choice. The focus here is always on Japanese longevity, healthy aging, food habits, and disease prevention explained in a clear and realistic way, without trends or exaggeration. If you'd like, leave a comment with the phrase, "This made sense to me." It helps show which topics are resonating and lets me know you stayed through the full discussion. And if this video delivered value, a simple like is an easy way to acknowledge that. There's another video available that complements what we covered here and builds naturally from these ideas. You can continue from there when you're ready.